All right, Mr. President, you're live.
All right, good afternoon, everyone. Welcome to our Vaccine Oversight Workgroup meeting, a weekly check-in on vaccine distribution. I do want to start on a really positive note when it comes to the state of Maryland and the COVID virus spread. As of when the first vaccine became available, and I think Mr. Powell will end up mentioning this again, but December 14th, we've seen the number of new cases decline by 61%. This is a really positive sign. The challenge, of course, is that we are in a race against time and a race against variants. And so there are very, very positive news when it comes to Marylanders engaging in social distancing and mask wearing and the things to stop the spread. And so now the light is at the end of the tunnel, and it's getting these vaccines still remains our top priority to get through this crisis. Don't want to belabor the point. I'm going to go ahead and hand it over to Mr. Powell, who's from the Office of Program Evaluation and Government Accountability from our Department of Legislative Services, to give us the check-in for the week.
Thank you, Mr. President. And Jake is sharing PowerPoint. When that pops up, I'll start to talk about it. All right, so first slide, as you mentioned, the number of new positive cases in the last week was about 61% lower than it was back in middle of December before vaccines were available. Tests are down 30%. The positivity rate is down 40% since then. So improvement in new cases positivity rate. Jake, next slide. This shows the amount of vaccines that have been administered in Maryland since we started doing it. The blue lines are people receiving a first dose on that day. The orange are people receiving their second dose on that day. The number of doses going out last week was actually very similar to what it was the week before, but you can see the trend in vaccinations. Next slide, please. This shows the orange area is vaccines that have been administered or given. The blue shows what has been made available to Maryland. It looks like there was a significant increase in the number of vaccine given to us about a week or so ago. I suspect we are using more of that every day. Next slide. So I introduced this last week, even though I think it's too early to do any real analysis of it, I do want to keep including it. This shows the death rate in Maryland from COVID-19 and the case positivity rate or the testing positivity rate. What public health experts have said is that the death rate will decline at some point greater than the positivity rate because the vaccines are going to people that are most at risk for getting sick, being hospitalized, and even dying from the disease. I think it would be too early to even see if that was happening, but we'll continue monitoring it, and hopefully at some point it'll tell us a good story. Next slide. Just to show the ratio of first to second doses, I think in the past week it was about, for every 11 first doses, we gave about 10 second doses. And I expect that kind of ratio would continue until there is an increase in doses made available to the state from the federal government, at which point we can start getting first dose vaccines to more people. Next slide. This is where how Maryland compares based on CDC data to the other 49 states and the District of Columbia. The further you are to the right, the higher percentage of your population has received a first dose, and the higher up you are on the graph, the higher percentage of your population has received a second dose. So you can see Maryland with about 10.5, according to the CDC, percent of our population getting a first dose and about 3.5 maybe getting a second dose. You could compare that to a place like Connecticut, which is further to the right and up on that blue line. They're at about 13 or 14% receiving a first dose and a little over 5% receiving a second dose. I did check, and it seems that Connecticut, for whatever reason, has been provided maybe 20% more vaccine per person than Maryland has. I don't know if that's just they got a shipment earlier than we did or what the reason for that is, but I think that might explain why they're a little bit higher than us in some of those areas. But we'll continue to watch this. Maryland looks like it is sort of towards the back of the middle of the pack, but certainly not an outlier either on the plus side or minus side. Next slide. This one just shows how we compare to the other states and how that's changed over time. And this shows the percentage of the population getting a first dose. Again, we are have been in the middle of the pack and continue to be so. And on the next slide, does that same comparison, but for people receiving a second dose. And it looks like, at least compared to other states, we've improved a little bit over the last week in the percentage of our folks having gotten a second dose. So that's good news. Next slide, please. We took a pretty good look at equity this week, and let me just walk through what this means quickly. So if we look at the furthest left category over there for females, so females, women are 52% of Maryland's population. I'm going to go over to the red for a second. They've been 48% of the COVID-19 deaths in Maryland and 52% of cases in Maryland, COVID cases. They've received 62% of the vaccine. So I just want to be clear as to what we're looking at. And I'll point out three things maybe. One is that if you move a little to the right, Black or African-American Marylanders, they're about 31% of our population, and 35% of COVID-19 deaths. And at this point, just 15% of the vaccine recipients. That is just for first doses. And then also for Hispanics and Latinos in Maryland, they're about 11% of the population, 9% of deaths, and 4% of the recipients of first dose vaccinations. The other two I'll point out are the 70 to 79-year-olds and 80-plus-year-olds. As you can see, they have received a disproportionately high number of vaccinations. 70 to 79-year-olds are 7% of Maryland's population, but they've got 19% of the vaccinations. That's purposeful. That's because we carved out phases to give to the folks who were most at risk. And you can see why they're most at risk is because they make up respectively 25% and 47% of the COVID-19 related deaths in Maryland. So, it indicates that our efforts to try and get the vaccines to the right people are at least somewhat successful. Next slide. We looked at geographic equity. This shows that same data as before: population, people receiving first doses, deaths and cases by county. And the only one I really want to point out is Prince George's County, which is, I don't have the labels on here, but I think they're around 15% of the state's population. That's that blue line, and just maybe 7% of first dose vaccination recipients. They are the major outlier that I can see in here. There are a couple of other counties that have gotten a little bit less than sort of their fair share, for lack of a better term, and some that have gotten a little bit more. But the one outlier that I see is Prince George's County. And if there is a next slide, Jake. Nope, that's it. So thanks for your time. I can answer any questions if you have them.
Thank you, Mr. Powell. Let's go ahead and move over to Acting Secretary Schrader for his overview.
Mr. President, can you hear me? Thank you, sir. All right, I want to thank everybody for the opportunity to follow up this week. As I mentioned last week, our priorities are speed, equity, and addressing the local health department concerns. Maryland, and I just want to touch on three things. One is that Maryland's been providing vaccines for about since January 11th to the federally qualified health centers, and we've distributed about 8,600 vaccines to 17 different community centers. These are being used to reach our underserved and most vulnerable communities. On February 9th, last week, the President announced the launch of the federally qualified health center program that will actually provide more vaccines for those community health centers, which is good news. The program is going to be phased in, and we have not been given a lot of information yet, but we're tracking this very carefully over the next week or so. Also, I mentioned that the federal retail pharmacy program started on Thursday, the 11th. 18 CVS locations in Maryland received about 12,000 doses, and we had asked that they prioritize 65 and above educators and people with intellectual development disorders with their doses, and they appear to be doing so. So that's issue number one. Issue number two, in recent discussions with the counties, their number one request was that we give them projections to allow them to plan for several weeks in advance. And the governor announced last week to show forward motion there, and Maryland is now providing a 4-week projection for local health departments, and the federal government is giving us a 2-week look ahead, but we feel pretty good about giving a 4-week look ahead to our local health departments. There's a complete breakdown of the 4-week projection for the health departments in Appendix 1 of the Week 10 Bulletin. Everyone on the call should have received that last Friday, and that was the projection for all the local health departments. And we've asked the local health departments, in addition to that, to identify at least one independent living facility or community a week in partnership with its local area agency on aging, and at least one congregate living for people with disabilities, which serves intellectual and developmental disabilities. We're asking them to focus on that, particularly now that they have the ability to plan ahead for 4 weeks with the doses. And we've also asked the local health departments to partner with the Maryland Department of Aging and Disabilities in order to do that coordination. And we are giving them the lists that we have so that we can share information. The last point I'll make is on mass vaccination sites. Wanted to say that last week was our first full week. And despite the snow, we put a lot of vaccinations into arms. It was quite a tribute to the dedication to our National Guardsmen and medical community who were working at Six Flags, and they delivered a lot of shots. And as I said before, our goal, particularly for the weekends, is to have those facilities open on the weekends so we drive up. And as you can see, this past weekend, we had almost 20,000 shots on Saturday and about 16,500 on Sunday. So those objectives are starting to move along. We also opened the Baltimore Convention Center, which will be followed by the M&T Bank Stadium on February 25th. And our target for Six Flags is 2,000 shots a day. 7 days a week, so we're moving that along. We've also are building additional partnerships with the National Guard as assistance to Prince George's County's Health Department. And last week we had our first targeted event working with Luminous Health at Reed AME Temple in Prince George's County. So we're again pushing vaccine to encourage penetration into hard to access communities, and Reed AME Temple has been helping us with that. And then we're also wanted to highlight the fact that Giant vaccination partners are working with Melwood and the Arc of Prince George's, 2 developmental disabilities providers starting this week. So I want to thank Secretary Beatty and Secretary Kramer, who have been working tirelessly to help us get that off the ground. So with me today, I have Steve Hsu, who's our Section Chief for Operations Intel, and Steve Colby, who's the Department of Health Chief Technology Officer, to help answer any questions. And I'll turn it back to you, Mr. President.
Thank you, Mr. Secretary. Very helpful. I just have a couple questions, and then today we'll do similar as before. We'll kind of do 5 minutes of questions in the order for senators so that you are aware. Senator Young, followed by Senator Eckert, Senator Washington, Senator Rosebep, Senator Lamb. A couple of so there are 2 major issues that I wanted to just flag and get your thoughts on. The first is diving into this Prince George's County as the geographic equity and racial equity component. And I know there has been work done on focusing, and you mentioned the Six Flags. I'm curious what your perspective, my understanding, correct me if this is incorrect, is that as you look at the county allocation, all the different various administrators, so it could be local health department, a mass vac site, a retail location, a hospital, all of them would be aggregated to say, okay, this week, let's call Prince George's County was delivered X number of doses. And then that would be compared to all other administrative sites in a different county. But for some reason, Prince George's County is significantly behind, even with the mass vac site. And I'm curious, what is your diagnosis of the problem there, as to why is it not happening at pace? Oh,
I'm sorry, excuse me, I had it on mute. I'll give you an example. As we stood up the mass vac site at Six Flags and put it right into Prince George's County, we reserved, vaccination allocations or appointments for Prince Georgians. We worked with the local health department. We actually have a call center calling into Prince George's County, working with their list. And despite all of that, we still found most of the appointments were taken up by folks from other parts of the state. Montgomery County, for example, had 3,300 people make appointments. And they came from 22 of the 24 jurisdictions. And we actually had reserve spots for Prince George's County ahead of time. And so I think we still have tremendous work to do, which is why this event with, clinic that we're holding with AME Reed Temple is really critical, because we need more people from the community who are standing up and saying that we need this vaccine. Because we can push the vaccine in, and remember, it's three things: it's speed, equity, and local health department support. And if we hold back and say, well, if it's not being used, we're going to hold that back, there are other people in the state that could be getting vaccinated. So we're trying to balance those three issues. So I think we got a huge amount of work to do on vaccine confidence.
And who's the best distributor, from your perspective thus far, 6 weeks or a little bit more in, for getting in Prince George's County residents and to see a greater pace of residents getting vaccinated?
Well, I think we're seeing good work from Kaiser is doing well. The hospitals have been doing well. We see their numbers up. But what I want to do next is really start to ask the question you're asking in terms of who is best penetrating and getting vaccine confidence within that community. We don't have that answer yet.
Okay.
We'll take that question down and come back and address that next week. And as you know, General Burkhead has stood up the task force. We're working very closely with her. She is laying out a very ambitious plan. So we can have her here next week to have this conversation. But I want to start drilling into that question, because whoever can do it the best, we want to use them first.
Great, thank you. This is a bit of an aside, so I apologize for jumping, but I want to make sure that I don't take up too much time. The 211, so we continue to get constituents calling in, and I have had many senators over the last week ask, where should we be sending them to have somebody help navigate? We had people calling into 211, and when they called in, the call takers were saying they've been sending people to us, but we can't help them. And we don't know why they're sending them to us. Or we've had another instance where we were sent to a Department of Health phone number that they were on hold for a pretty long time. And this was a particular case in Montgomery County. And then the Department of Health person recommended that they go to a vaccination site in Washington County or in Allegheny County. So what's very clear is I think there's still a lot of frustration, especially for our seniors who may not have the website availability. They're desperate to talk to somebody to be able to help them navigate. And to the degree that there can be some more training for 211 or the health department, that we can have a single point of entry to help people navigate, I think would be enormously helpful.
I appreciate that feedback, Mr. President, and we have high expectations for 211 Press 2. and we will circle back to see what the issue is there. But we feel the same way. So thank you for that.
Thank you. Senator Young.
Yes, thank you. The mass sites, Prince George's County, like Six Flags, are they still prioritizing the groups like 75 and over, pre-existing 65 and over teachers, or anybody that comes?
No, we're using our priorities, 65, 75, and teachers are where the priorities are. And that's what we're seeing in our appointments.
Okay, this relates to a question I've asked before. If we're sending vaccines to these mass sites, we have to be cutting the locals if we're not getting more vaccines. So how are you adjusting that, and how much are the locals being cut in order to send them to these new opening mass sites?
Well, we have been giving about a third of the vaccines to the locals right along, and they're a key partner. The thing we like about the locals for the local jurisdictions is they have waiting lists for the locals. The problem is we just don't have enough vaccine to give as much as everybody wants, but we are using the local health departments as a cornerstone. They're doing about a third of everything we're doing.
The president said he ordered 100,000 from each of the two, or 100 million from each of the two major companies. Have you gotten any indication when any of that will be available?
We have not. We speak, obviously we have regular back and forth with the federal government. We have a call on Friday with the White House staff as well as the CDC, and we have not been given an indication of when that's going to happen. But I will say this, they are incrementally stepping it up. So we were at 72,000 3 weeks ago, and then it jumped 16% to 88,000, and then they've given 5% increases over the last 2 weeks, 5% a week. So we're seeing modest increases, but not very large increases. But I think once the J&J is released, we're hopeful that we'll see a lot more from that.
I'll just do one more, and then I'll let somebody else take over. And it gets to equity, and not only the African American and Hispanic communities, who are obviously getting far less vaccinations for whatever reason, but we have the very rural areas. We have the poor in the inner city. You also mentioned, I think there were about 18 CVS sites. How does anybody know where those 18 sites are? And they aren't in some of these poor areas. So how are you reaching out to people that don't have computers and don't have cars?
Mr. Secretary, I think you may be muted.
I'm sorry. Thank you, Mr. President. So we are monitoring those 18, but they just got started. So we have to see how they do. We saw some news reports, obviously, of some positive, but that's anecdotal. I want to see how it affects our data, and then we're going to have to start. We've given them guidance, but of course they're getting their doses directly from the federal government. So we're going to be watching them very carefully, but it's a little early to draw conclusions.
Senator Young, I think you're muted. If we could.
Okay. My question is, you said there's 18 of them. How do we know where they are?
We can get you we have a distribution. We'll get you a map, and they're all around the state, and it was determined by the federal government as to which ones and where.
Okay. I'd like to get that list if I could. Thanks.
Thank you,
Absolutely.
Senator.
We'll make a note of that and get that to you.
Senator Eckert?
Thank you very much for unmuting me. Thank you, Mr. Secretary. Just a couple of thoughts and questions. First of all, is there any requirement that you have to be a Maryland resident to be able to qualify for the vaccine if it's distributed through CVS and or Walmart?
Well, we encourage that Marylanders be vaccinated. But for example, we have an MOU with Virginia and DC that if somebody's getting a vaccination near their place of work, that we will vaccinate each other. So and the CDC has discouraged us from withholding the vaccine unless it has a clear public health purpose. They put some new guidance out last week. Originally, they had a prohibition, but then they came out with some new guidance just last week and said that if it had it would be hard to turn somebody away based on a public health issue if they show up. And so obviously we want to get people vaccinated. And that's why we have the agreement with Virginia and DC, so people don't get turned away.
It's Delaware, in Denton, Maryland, at the Walmart, and our Walmart in Cambridge, and the one in Salisbury. We're real close. In fact, it's quicker for Denton, Delaware folks to get to Denton than it is for Cambridge folks like me to get to Denton. And I had a Zoom call with a lot of combination of commissioners, health officers, and superintendents last week. They shared with me that there are a lot of Delaware tags and they're waiting in line to get theirs because Delaware is not doing a very good job. So I just wanted to give you that piece of information because that's a problem, particularly when I have seniors who are older than I am actually, and they signed up with CVS on the shore and they were told the first available appointment was in Waldorf, Maryland. So they went to Waldorf and got their injection, and then they signed up and they're scheduled to go back to Waldorf. So it just seems to me that folks who are compromised, are desperate to get the vaccine, but they're going all over. And the second, so I just wanted to give you that feedback because I continue to hear from seniors who are compromised that they're just still not being called on the list. So I'm telling people now, with all due respect, call the health departments personally and make a case for your situation because they should be for the listing. And then just a little feedback on the 211. 211 may work well on the shore, but it's not working well in other places. And it's not only when you call about COVID vaccine sites, it's if you are in need of suicide hotline, they are telling that they can't help you. So we need to look into that as well. That's a major concern for me right now. So, but thank you. I know you're working hard and I know we don't have enough vaccine and this too will be water under the dam shortly, but it's still frustrating to many, many of our citizens.
Thank you, Senator.
Thank you, Senator. Next up, we have Senator Washington.
Thank you. Thank you so much. Okay, good. Thank you. And thank you, Secretary. We appreciate the work you're doing. I want to follow up, and I think I want to build on Senator Eckert's questioning and actually following up on the decision to have this sort of very disparate, less than coordinated, centralized approach. So this has to do with making sure that we're getting the shots into the arms that they need to get into. And so last week we asked about verifying that a person is eligible and if there's any way to require a checking. And you said there's an honor system. Can you, again, because the purpose of this group, this work group, is to really get into the detailed focus of this plan. And so the honor system as a plan for making sure that the shots get into the right arms. Could you describe how that honor system works?
Right. So if you show up, we ask for your ID, and we try to determine if you're 65 or 75, or if you're a teacher, if you have a work ID. But if you are undocumented, we're not going to turn you away.
Right.
And so, or if you don't happen to have your ID and it's obvious that you're 65, we're not going to turn you away. So what we do is have people sign an affidavit attesting. So that's what we mean by the honor system. That doesn't mean we're not asking or we're not expecting, but if somebody shows up and they went through all the trouble to get there, we're going to vaccinate them. But we do ask. But so what we need, it's not, when we say the honor system, is that we're hoping that when you sign that affidavit that you're telling us the truth.
Okay, so a follow up on this. So I think our question was about ensuring that the providers are asking those questions. So at this point, it's sort of kicked down to the individual to tell the truth. Let's kick it back up to the provider, because we are, even though it's working through the federal government, you're the health department, we're the state. At the end of the day, we're responsible for all of the vaccines that we get in the state of Maryland. So ultimately, you're responsible for that. Okay, so the partners that we have, what's the process, or is there an auditing that they're asking those questions?
Well, let me start. A third of the vaccinations are being provided by the local health departments. We have tremendous confidence in the integrity of our local health departments, so we don't believe that we have to look over their shoulder to make sure they're doing what we're asking them to do. We give them guidance. Every week there's a bulletin. Everybody on this call has seen the bulletin, tells them what the priorities are. So we have very high confidence in our local health departments. We also give vaccine to our hospitals. Same thing. Hospitals are highly regulated industry, and we have confidence that they're doing the right thing. And then we're running the mass vac sites. I know that we're doing that. So, and then of course, we're the other channel is through the pharmacies, and we're hearing anecdotally that people are being asked these questions. So we're not going out and sending secret shoppers out to look to see if they're doing it. We expect providers, and if we hear about it, if you were to call me and say you've got evidence that a particular provider has done something untoward that's contrary to our policy, we'll go out and investigate it immediately.
Right. So just so I understand, so our approach to taking responsibility that the shots get into the right arms is a trust but not verify. So part of why this is important is that the phasing and making sure there is a public health implication, right? So making sure it's safe and it's effective is making sure it gets into the right arms. I guess my second question has to do with the, I guess it's sort of continuing that the federal government is doing some safety surveillance. It's looking at its systems and trying to figure out, what's working and not working. And in the past meetings, you've said or implied that it has something to do with demographics in terms of equity. But I'm looking at DC and I look at Virginia, and there's some similarities, and they're doing to Maryland, they're doing much better. Have you reached out to DC, which is, very close, to see what is DC doing that their first dose and second doses are so much higher and better than ours?
Well, I would respectfully say that we're doing a pretty darn good job. We now are close to 90% of first shots, and we've got a very high percentage of our second doses going into arms. So the numbers speak for themselves that we are getting people vaccinated every day.
Yeah, I'm sorry. I guess I wasn't clear. This has more to do with the equity or the inequities that we're having within populations, within the Latinx population, still among African Americans, and again, to Senator Young's point, our rural populations and low income. There's some very similar demographics. So, you know, we're not going to look at Connecticut. We're certainly not going to compare ourselves to Alaska, although in terms of poverty rate, there could be some similarities. But early meetings, there seemed to be a resistance to look at what other states are doing. But I'm sure you didn't mean that. So I'm just wondering, are you communicating with health departments or the folks leading the vaccine programs in
Yeah,
DC?
we actually, with the White House, had this very conversation, and what we've asked the White House to help us with, and CDC, is tell us what are the critical success factors that have very high probability of getting minorities and people of color to take the shot. And they said they're working on it and they want to give us information, but they don't have a silver bullet right now. And so yes, you're exactly right. And on that call is DC, Delaware, Pennsylvania, Virginia, ourselves, and that call has been happening every week. And we're point blank asking people, tell us what the critical success factors are so we can implement those. In the meantime, we've got our own equity task force that's being led by Brigadier General Burkhead. She's getting very highly organized and we announced the GoVax campaign, and we are pushing out ads you've probably seen to begin to build confidence from trusted voices in the community.
Right.
So we're hoping that that's going to make a major impact, but we are consulting with our peers and asking them point blank, what are the critical success factors that you're finding? So if we're not doing some of that, we'll borrow it.
Okay. All right. We'll follow up next week. Thank you. Thank you, President.
Thank you, Senator Washington. Next, we have Senator Roosevelt. Senator, you're still on mute.
All right, let's try again.
There it
Okay
is.
now? Okay, thank you. So following up on Senator Washington's question about reaching hard to reach populations, I have to say, everyone on this call knows I'm a big fan of Joe Biden and Kamala Harris, but I would not wait for the president and vice president to tell us how to reach hard to reach communities in Maryland. I congratulate the department for working over the last week or so with Delegate Jocelyn Pena-Melnick on an effort in the Latino community in Prince George's County. But I would suggest get with Senator Washington, get with those in Maryland who know the community. Joe Biden is not going to solve this problem for us. We got to solve it here. So I think we have more than enough people here who know the communities who can help with that. So I just urge you to do that on a bigger scale. So I got a couple of unrelated questions. One is,
Senator, may I comment on your point because it's well taken?
Sure.
I agree with what you said. I was merely referencing Senator Washington's point that are we talking
comparing to other states? I understand.
Yeah.
And I think that's right on a systemic basis.
Yeah, and that's why people like Vice Chair Pena-Melnick are really the people we got to be working with. So I just want to make sure I don't disagree with you.
No, absolutely. And county commissioners and all kinds of folks. We have a lot of expertise here about how to reach people in Maryland. That's kind of what we do for a living. Next issue is I'm still unclear. If somebody doesn't have internet, isn't comfortable with the internet, doesn't speak English, and they want to set up an appointment, are they supposed to call 211 and somebody on 211 will set up an appointment for them or not?
Our expectation is when they call 211, and we've done our own follow-up on this, that they should get help. And they go into our website that has all the locations. It's got all the phone numbers because you're right, people sometimes want to use the phone.
So who goes into the website? The 211 operator?
The operator is supposed to go in and find it, and we've had people do it to test it. And now I'm not going to say it's 100%, but that's our understanding. And and I will mention we are looking at ways to expand that capacity. As you know, we're making phone calls for people to the mass vac sites because we don't want.
I understand. I'm just asking so we're clear. We should tell our constituents if you want to set up an appointment, call 211 and they will set up the appointment for you. Is that correct?
That is my understanding, is that they will guide them to an appointment.
What does that mean? Guide them to an appointment?
Well, if there is if they need a phone number to call and they want to know where can I get vaccinated in my area, we give them the information they need.
So the 211 person will give them 10 phone numbers to call 10 different places to sign up?
No, if they're in a particular area and there are 2 locations nearby, they're going to give them the 2 locations nearby, not 15.
And you're confident that the people at the 2 locations will speak multiple languages and therefore will be able to help people who don't speak English?
Well, I'm not going to. I'm not sure about that.
Okay. Could you pursue that? I mean, this is.
Yeah, we'll look into that.
This is mission critical, so I appreciate that. Thank you.
Yeah.
So, next question, we've talked about week by week. Is the department still opposed to a central registration system the way other states are doing and the way individuals are doing their own apps for? Is you still opposed to a central registration system for appointments?
We've looked at this, and I'm going to turn it over to our Chief Technology Officer, who's
Great.
done quite a bit of work on this, Steve
Great.
Colby. Can you address that, Steve?
Sure.
To the Senator.
Senator, so you wanted to ask about a central registration system, correct?
Yeah, are you still opposed to it?
Yes, we've looked
Okay.
at 4 states in the union, or we've looked at all 50 states in the union. There are 4 states that have a central registration system: New Hampshire, New Mexico, Oklahoma, and West Virginia. So only 4 states are adopting that model.
So why is that an argument against it?
Well, they're not good analogs for the state of Maryland.
I thought West Virginia was leading the country in getting vaccinations done.
Right. Well, they're a rural rural state with more densely populated areas than the state of Maryland in terms of their population centers, and that would account for why they're having more success with or why they would have taken a centralized approach, at least in terms of the research that we've done. So the model that we're following is a model that gets the vaccine out into as many places as possible, rather than just going to specific county centers.
Can I add one other thing? We talked about this. One of the things that we want to do is by giving, and the counties asked for this, by giving the counties doses that they can rely on, and now we've got a 4-week projection. The counties actually have pre-registered lists, and what we're very confident in, and I think this is definitely better, is that having the counties handle those doses with the doses we're giving them. They know their counties better, rather than, and you probably saw recently where Virginia's going to roll up all the counties' work that they've already done.
Right.
And the concern there is that, and I think Fairfax County pulled back from that and said no, they weren't interested. But we're giving doses. We're giving a third of the doses to the local health department.
Mr. Secretary, I understand that. I just wanted to get it clear. You still are opposed to having central registration. I'll take it your word.
Yeah,
Okay.
yeah.
I got 2 quick questions, Mr. President.
Very briefly, Senator, just we have time.
One is, the Secretary talks about Prince Georgians don't want to get doses. I mean, I literally, while I'm on this call, got a text from a Prince Georgian who said that they've signed up at Kaiser, doctors, and the county and not heard anything from anybody. I don't get it. There are many Prince Georgians who want to get vaccines, and to say that, well, nobody in Prince George wants to get a vaccine, therefore they're all coming from other places, doesn't pass the laugh test. What is the problem?
Well, I hope I didn't suggest that nobody in Prince George's want. We are getting a certain percentage of Prince George, but as we push vaccine and more vaccine, we're not getting as many folks as we would like to get vaccinated.
Well, you have people on waiting lists in Prince George's, one of whom is my constituent. Mike just contacted me.
Okay.
Nothing from nobody.
Mm-hmm.
They've signed
All right.
up in all these different places. They've heard nothing from nobody. You understand why that's the case? Okay. Thank you. Thank you, Mr. President.
All right, thank you, Senator. Next we have Senator Lamb.
Thank you, Mr. President. Thank you, Mr. Acting Secretary. You had mentioned earlier that your top priority really is an equitable distribution of these vaccines. You've mentioned it in these meetings and also in press releases from the department. I want to make sure that we are actually reaching equitable distribution across the state. And it's hard to know that without actual information broken down by how much is going to each county, regardless of whether or not it's going to a local health department, a hospital, a retail location, a mass vaccination site, or et cetera. And I've asked for this information, and it seems like others have asked for this information as well, whether it's MACO, local health departments, who also want to try to get to the pockets of populations that have not been reached, and also the Baltimore Sun apparently too. But this information is not forthcoming. I'd asked for this before this meeting, and I still don't have it in hand. When can you get us this information? Because I think it's incredibly important to actually verify that the distribution is actually equitable across all these jurisdictions, because without that, we wouldn't know how much is being made up for a lack of local health departments by additional allocations going to retail locations or hospitals, et cetera, et cetera. So when can you get us this information?
So based on your request, we have developed the initial documents, and I believe we sent it over this afternoon, but we started with 4 jurisdictions that were illustrative: Baltimore City, Howard County, Montgomery County, and Prince George's County. I'm going to ask, can we bring that up on the screen?
Yeah, I asked Jake for permission.
Oh, okay, we're waiting.
Oh, there we go, got it.
Got it? Okay, we're going to bring it up on the screen to show you.
How long will it take to get the rest of the jurisdictions? Because I assume this is the data
By
that's
the end
driving
of the
all of
week,
your decisions.
Well, we wanted to show you this to make sure this was answering your question before we did all 24. So I wanted to show you these 4 today, and then if this is moving in the right direction, we'll do the rest of them, and you'll have them by the end of the week. But here's Baltimore City. You can see there's the transfer pharmacies, Moderna versus Pfizer, the hospitals that have gotten doses, the federally qualified health centers, and the local health department. And this is weeks 9 and 10. And so you can see that's 10,350. If we go to the next one. Howard County, got a couple Giants and a Safeway, Howard General, and local health departments. And you can see in these numbers, we are sending, good percentage, and it'll vary. I have another chart here in a minute to show you, but 5,200 in Howard. Next. In Montgomery County, 22,875 over 2 weeks, and it gives you the pharmacies, the hospitals, again, the FQHCs plus Kaiser, and the local health department, about 9,000. So, and then the last one, Prince George's County, again, the distribution. So this should be have come through this afternoon, and I know it probably was mid-afternoon because we were working. We've been working since last week to make sure we got this data right and through the weekend.
Well, thank you for that. I think using the example that you're showing right here with Prince George's County, I see that their allocation was actually less than Montgomery County. Is it taking into account the fact that it's harder to reach some of these Prince George's County residents, as Senator Rosapap was saying, they're being vaccinated at a lower rate? Should that not be taken into account when you're looking at these allocations as well to make up for that difference, to try to catch them back up?
That's a good point. Can we see that next one? Do you have the let me show you this, and then we have one other item I want to show. So this shows you the variation by the counties, and then we have some data that I can get to you that we just got from Howard County, and it shows that Howard County actually is 100 or a very high percentage of Howard Countyans are going out of county to go elsewhere, in addition to the fact that Howard County is getting more than other jurisdictions. So what we're looking at is the patterns of people, and even though we allocate doses into jurisdictions, somehow other jurisdictions are like Montgomery County had of the first 12,000 appointments for Six Flags, 3,300 came from Montgomery County. So what we're learning is the migration patterns of people from county to county. We can't control that. That's the human behavior. On the front end, though, we are allocating equitably, as you saw, to the counties to make sure that the planning and the order allocation is fair. But we can't control if 3,300 Montgomery County residents go to Six Flags, we're not going to stop them. Or the same
and I
thing
understand.
with Howard County actually received the highest percentage behind Montgomery County of people that took advantage of going to Six Flags.
And I understand that. And I think that's why it speaks to Senator Rosebef's point of having one single line so that you can actually direct people to go to wherever is most efficient or closest to them to get that vaccine. I understand that, the desire is not to go into one single line, but the other letter that you sent in response to MACO reaching out to the governor's office is, and you had cited the fact that there are adjustments being broken down by county and for those providers that are most efficient and also who comply with the vaccine priority directives. What are these adjustments? Can you give us a breakdown of these adjustments? Does that mean that some counties are receiving more and others are being punished because they're not either complying or administering as efficiently, so to speak?
Well, I'll be honest with you, that policy was more relevant in the very beginning, in the first 4 weeks. If you recall, the big concern for 4 weeks in, we were, the populations that were eligible were facility-based. Actually, that went into weeks 5 and 6 because we didn't start B or 1B until the 18th. So for those first 4 weeks, the big concern was we weren't getting people vaccinated fast enough.
But this was your response from last week.
I'm sorry?
This was your response last week to MACO. This was in your letter to them last week.
I'm explaining to you what happened is that the issue is shifted because in the first 4 weeks, the distribution was being made to facilities, and then we've only been now 4 weeks in since we opened up 1B, and now we have data and we're collecting the data to see how fast are people going. But my point is, in the first 4 weeks, when the nursing homes and CVS and the hospitals were not vaccinating fast enough, we put this 75% rule in to encourage them. Since then, that has become less of an issue because as people are getting these vaccines, as you can see in the daily report that you receive, the hospitals and local health departments are actually moving. As of today, on Monday, and the new deliveries come usually on Tuesday and Wednesday, but the hospitals have distributed or administered 91% of their first doses, and the local health departments 92%. Walmart and Giant are at 100%. So it's less of a problem now because these providers are getting their momentum and getting these shots done.
So if you can share that data with the rest of the counties with us, that would be great. One final question. I've been receiving a lot of concerns from constituents about the fact that the state has moved to 1C, but many counties are still indicating on their website that they're on 1A or 1B. Some have indicated that they are registering or pre-registering people for 1C, but it's not clear that they're actually in 1C. Why is there so much confusion as to why the state has moved to 1C, but it seems like a lot of the local county health departments, when you actually go to the local website, they say that they're on 1B and 1A, and it's generating a lot of confusion amongst our constituents. What is actually the status of where these phases are right now?
So we have granted the local jurisdictions the ability to make their own decisions about, we've authorized and made eligible 1A, B, and C, but we are not micromanaging the local health departments. If they want to be.
But it's set up a huge expectation that it's a huge expectation amongst our constituents that they can get a vaccine because they're hearing everyone tout the fact that we're in 1C, when locally, the reality is, and it sounds like you're aware of this, that the local jurisdictions are nowhere near 1C yet in many cases, that they're still listing 1A and 1B.
Some are, and so, see, the other side of that coin is there are many jurisdictions that were very concerned that they wanted to be in 1C and did not want to be stopped from going into 1C. So it was, so we gave the local jurisdictions.
In a lot of these jurisdictions like Montgomery, Anne Arundel, Prince George's, Baltimore City, Howard County, Baltimore County, they're all listing themselves as 1A and 1B. So it's a huge expectation gap that you're generating by touting that the state is in 1C when the reality is they can't get this at their local jurisdiction.
Well, there are 24 jurisdictions, and many of the other jurisdictions wanted to be able to go to 1C.
Senator, I hate to cut you off, but we have to. We're running up against our time limit.
Thank you, Mr. President.
Thank you, Mr. Secretary. Just in closing, a couple of quick points. First, it does sound like, I think that since Senator Eckert's constituent was going to Charles County for the vaccine, I think that there is this question around going where the vaccine is available. And so that is something I think that we definitely want to follow up on down the line. The other one is the data about the cohorts, 1A1, 1A2, 1A3. If I don't think we've seen summaries on that. If that's something that we could follow up with this week, just seeing where we are in the thermometer of each of those. And then finally, I do want to just.
May I just, I'm sorry to interrupt you, Mr. President. We have looked at that and we'll have more information. Some of it we can do and some of it's harder to do, but we put that in the letter and we can talk more about that next week, if that's okay.
That'd be great. That'd be great. And do want to just affirm, thank you for the county breakdown. That's exactly what we were hoping to see. So would love to see, that would be excellent. Thank you for sending that. And if we could have to see those for the counties, I think that would be incredibly helpful for backwards mapping and helping to pressure test different areas. So
we'll have that to you by the end of the week.
Thank you, sir. And thank you, senators. Off we go. Good luck this week, and we will see you in a week.
Thank you, Mr. President. You have a good day.
You too. Take care.
Yep.